Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. With me today is Dr. Bryn Henderson, and our topic is going to be about hypertension. Now, you may have hypertension. You may know someone who has hypertension. So this podcast is going to be a conglomerate of different information that can help you or a loved one know what hypertension is, how to manage it, and how to improve. Hypertension is often called the silent killer. Why? Because it can quietly damage the body for years before symptoms appear. Dr. Henderson, let's just start with what is hypertension?
Hypertension is defined as a sustained elevation of arterial blood pressure, typically categorized by systolic pressures exceed 130 and diastolic pressures that exceed 80, based on American Heart Association's updated guidelines. So hypertension's definition is when you have an increase in the force of your blood pushing against your blood vessels, which is consistently too high. Over time, this pressure can damage your arteries and vital organs like your heart, brain, and kidneys. What makes it dangerous is that it often doesn't show symptoms until it already has caused serious heart problems like a heart attack or a stroke.
Well, let me ask you a question. You've been a doctor for
45 years.
45 years. Tell us how many people you have had that had no idea that they had hypertension and ended up with a stroke or a heart attack out of the blue.
We've had a substantial number of people who presented with a stroke or right after a heart attack and they never knew it was caused by hypertension.
And that's why they call it the silent killer. So let's talk about how they first started measuring blood pressure in the first place.
Well, that'll be fun. That's a fascinating bit of medical history. The use of mercury in blood pressure measurement dates back to the early 18th century. In 1733, there was an English clergyman named Stephen Hales who was actually the first to measure blood pressure, though in a horse. Can you imagine?
Wow.
He inserted a glass tube into an animal's artery and watched the blood rise, essentially creating the first rudimentary manometer. Later, in the later part of the 19th century, Riva Rocchi, an Italian physician, revolutionized this by inventing the modern blood pressure cuff. He used an inflatable cuff and a mercury column to indirectly measure pressure inside human arteries. The mercury column provided a precise and reliable way to see how the high blood pressure pushed the mercury. And that measurement is still reflected in the units we use today, millimeters of mercury. Over time, enhancements like the stethoscope by Dr. Korkoff allowed doctors to listen for blood sounds and more accurately determine systolic and diastolic pressures. Today's cuffs, whether manual or digital, all trace their roots to these early innovations.
You know, one of the most fascinating things I heard over time was when I was in medical school, I graduated in 1980. The normal blood pressure, I really laugh about this. Normal blood pressure was, the systolic was 100 plus your age. So if you had a 75-year-old man or woman, it would be 175 over 80. And then I kept asking everybody, why do they keep lowering it? And someone finally gave me the answer, and it was a study that they did in Massachusetts where they started following the Vietnam vets, and the boys were young, then they were in their 20s, and through the Veterans Administration, they followed them now, for 60 years, and they saw all the side effects that happened as their blood pressure went up, And that's why they kept lowering and lowering and lowering the numbers. How do you feel about that?
Is that the Farmingham study?
I'm not sure the name of it. I just know they did the Vietnam vets.
Well, I was there. The burden of hypertension lies in its pervasiveness and its role as a modifiable risk factor for nearly every major cause of morbidity and mortality: stroke, myocardial infarction, heart failure, chronic kidney disease, to name just a few. The real challenge is compounded by our poor awareness, suboptimal adherence to treatment, and its multi-factor nature: genetics, environment, behavior, and all the comorbidities that play a significant role. Comorbidities meaning those other associated illnesses. Over time, this strain can cause serious damage and increase the risk of cardiovascular events.
So that takes me back to the question is, how do you feel about these diagnostic thresholds that we currently use? And as an individual physician over the years, do you agree with lowering an 80-year-old man down to 130 over 80?
No, I don't. In the United States, we follow the American Heart Association and American College of Cardiologists criteria, which now the goal be 120 to 130 over 80. But stage 1, again, begins at 130 over 80. And conversely, the World Health Organization maintains a slightly more conservative threshold. It states that hypertension is diagnosed when the blood pressure is consistently over 140 over 90.
Well, that makes more sense to me. And you got an 85-year-old man or woman, and they're stable. They don't look like they're anything, and they always get so worried. They go, "Oh, she did my blood pressure. It was 140 over 90. It's high." I go, "Don't worry about it. You're good." Yeah. All right. So moving on right now, let's talk about what white coat syndrome is, because a lot of people have their cuffs at home. They do it. They journal it. They bring it in. They go, "Look, doc, I've had consistently 140 over 80 at home. I come into your office, I'm 170 over 90. Let's talk about the fear of having the doctor tell you something's wrong with you.
There's a lot of factors that go into raising our blood pressures. And one of them is fear, of course, but it's stress of any kind. The body has a normal built-in automatic mechanism to increase our blood pressure anytime we feel that there is going to be danger.
A lot of times my patients, again, say, well, my blood pressure cuff at home says this. Your blood pressure cuff in the office says this. What I recommend, bring your blood pressure cuff into my office. Let's calibrate them together, because we're having somebody come into the office every 6 months to calibrate the blood pressure cuff. That cuff could go wonky and they don't even know it. It could be 5-10 points off. And so I highly recommend that when you go for your checkup, bring your cuff.
So maybe the better question is, how come some people develop high blood pressure and others don't? It's often a mix of genes and lifestyle. Some people inherit a tendency towards high blood pressure from their parents. Others may develop it due to poor diet, lack of exercise, stress again, or even sleep problems like sleep apnea. It's really a combination of what's in our DNA and how you live your life.
Right. So you mentioned genes. Everybody's really into genes right now and their DNA, and it's all over every place you look. Can you explain how genetics influence hypertension?
Sure. Hypertension is influenced by multiple genes. Some affect how your body handles salt. Others regulate hormones that control your blood vessels. For example, variations in genes like the angiotensin gene can make your blood vessels constrict more easily. But genes alone don't cause high blood pressure. It's when those genes interact with lifestyle that triggers the problems we face.
Are we seeing any promising results from integrative or complementary therapies like acupuncture with hypertension?
Yes, especially when stress plays a big role. Acupuncture studies another thing. In these studies, people had acupuncture 3 times a week for 6 weeks had lower blood pressure, and the effects lasted weeks after the sessions ended.
Okay, so let's talk about how they can get to an acupuncturist and have their insurance company cover it. I know in some of the, as you know, but maybe my audience doesn't know, I've been a traveling doctor for 10 years and I've practiced in almost every county in California. And they all have different insurance companies per county. And I have noticed that a lot of the counties do pay for acupuncture and chiropractic and some of these things that we would years ago consider kind of turn up our nose at it. But now they're saying, yeah, it does work and we're going to let our patients have it.
And I think that's a benefit not only to the patients, but to the companies that are allowing that. That's good for them. It's good for patients.
All right, let's get into a real case. You recently managed a 76-year-old woman with difficult to control hypertension. What made her case so complex?
Her blood pressure remained high even while on multiple medications, which we call resistant hypertension. She also had borderline diabetes, sleep apnea, and anxiety, all of which can contribute to poor blood pressure control. We had to fine-tune her medications, manage her sleep, and address her stress to get better results.
So what kind of treatments did you do?
Well, initially she was on losartan and hydrochlorothiazide. Those are 2 blood pressure pills. When those didn't work, we switched to clonidine and adjusted the dose. And we also encouraged lifestyle changes like dietary improvement, using a nasal device for sleep apnea. In the end, her blood pressure started improving because we looked at the whole picture, not just the numbers.
What are some of the novel or regenerative therapies that are gaining traction today for hypertension that is considered standard of care, of course?
Well, regenerative approaches, especially peptide therapies like BPC 157 or thymosin beta 4, aim to restore vascular integrity and reduce the oxidative stress. Chelation therapy has been shown a major cardiovascular benefit in selected population. These therapies remain adjunctive, but are reshaping the therapeutic landscape.
So if there's any physicians listening and they want to counsel their patients on lifestyle intervention, what would you, as a teacher and one who has many younger doctors in your practice, training them, how do you teach the younger folk how to practice medicine?
We counsel them because patients must be addressed in a personal manner so that they can sustain their behavioral patterns. That begins with the DASH diet, which is foundational. It's been around a long time. It emphasizes the fruits and vegetables, the lean protein, and the sodium restriction. Moderate aerobic activity, stress reduction, alcohol moderation, and smoking cessation are all crucial. It's essentially reframe these not as temporary adjustments, but as enduring lifestyle commitments that modify risk.
Well, people are not going to go out and go to the gym. Could you say anaerobic? Can't someone just go out for a stroll for a half hour and that be considered exercise?
No. You can't just go for a stroll. If you're getting readings that are elevated, especially if you have other conditions like diabetes, what we like to do is we like to take a history, find out if you're feeling dizzy or tired or have headaches in addition to having the high blood pressure. We don't want you to wait for the symptoms. Be proactive.
But so many patients are not going to give up smoking. They're not going to give up alcohol. I mean, the few that do finally get to a point where something happens and it scares them and they go, all right, I'm going to be proactive. But most of the patients want an easy fix.
The key is awareness and consistency, and then take an action. Even in the patient, many times are prompted because of those they love or love them. Hypertension so silent, or often so silent, it does damage before we even realize it.
Okay, so why do people have to eat a low-salt diet?
Well, a healthy diet is low salt with plenty of fruits, vegetables, and lean proteins. The DASH diet is a great example. Exercising regularly, aiming for at least 30 minutes of activity 5 days a week, will keep your heart strong.
All right, well, what do you call activity? I call activity going for a stroll. I'm not going to sit and go to a gym and lift weights. And I'm sure people listening are going, I don't have time. I have a full life. I have things to do. What can they do at home for a half hour?
Oh, time is a precious commodity. And, it doesn't take, but even a half hour a day is very good.
Doing what?
They can do bands. They can do all kinds of activities that make the heart muscle active. That's the key to the whole thing, is get that muscle stronger. In addition to that, the other lifestyle factors, avoiding the smoking, limiting to very little alcohol, and allow changes to reduce your risk of disease and stroke.
Yeah.
You got to reduce the stress. I think if you could reduce stress, you probably have control over more illnesses than anybody would ever appreciate. And you can do that with relaxation techniques, medication, or deep breathing. All help lower blood pressure. Taking your medicines, you take them exactly as they're prescribed. Don't skip doses. With the heart approach, that's the mnemonic we use to remember what we should be doing for hypertension. So we use the word heart to remember those things. The H stands for the healthy diet, and the E stands for exercising regularly. A is avoiding the smoking and the alcohol. The R is reducing stress, and the D is taking that medicine.
That would be nice if they would do that. So I want to thank you for being with me today on Doctor to Doctor. We hope that you've learned a little bit about hypertension. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.